another resource that I always like to bring up when we talk about quality of life, and that's goals of care conversation. And this is such a great resource. I really highly encourage everyone to kind of Google this.
Hey, VetFolio voice friends, thanks for tuning in. We've got a great episode for you here. This episode is sponsored by DECRA and features Dr. Haley Leeper, who joined me to talk about palliative care from her unique perspective as a veterinary oncologist. Now, palliative care is an interesting topic in and of itself. Just my personal opinion, but I feel like with so many effective options for preventative care like nutrition, parasite control, vaccinations, and many new and effective treatments for different disease processes, it seems like we're seeing dogs and cats live longer and longer lives with overall a pretty good quality of life. But of course, this longevity means more chronic disease and having to make decisions around care while keeping that quality of life in mind. Trying to strike that balance between providing treatment that will improve or prolong quality of life, but not prolonging stress or discomfort. I really enjoyed Dr. Leeper's perspective on this. As an oncologist, she really painted a picture in my head that was quite different from what I usually think of when I think of oncology. Often, as veterinary professionals, we're talking to our clients about chemotherapy and how animals tend to handle chemotherapy much better than we do as people. And Dr. Leeper explained that a lot of that has to do with the goal of treating cancer as a chronic disease and approaching treatment with less of a curative goal and more of a focus on maintaining quality of life for as long as possible. Beyond that, we talked about more objective ways to evaluate quality of life in our patients and tools we can use to facilitate the conversations around quality of life decisions. In this conversation, not only did Dr. Leeper's extensive knowledge and understanding of veterinary cancer and cancer management come through, but also just the care and compassion that goes into each treatment recommendation for her patients. Along the lines of palliative care and the development of new and better exciting options, we got a little more specific talking about canine lymphoma and how the availability of Laverdia CA1 or Verdinexor tablets has helped us buy valuable time for our patients and help keep that focus on maintaining quality of life. Let me introduce Dr. Leeper, and you can hear all of her insight for yourself. Dr. Haley Leeper is an associate clinical professor at Oregon State University's Carlson College of Veterinary Medicine. She earned her DVM from Western University of Health Sciences in Southern California before completing a small animal rotating internship at Oklahoma State University. She then completed an oncology internship and 3-year residency in medical oncology at Oregon State University. Dr. Leeper's interests include clinical research in comparative oncology topics that can benefit both companion animal and human health. All right, let's jump in.
Nutrition is the cornerstone of our patients' health and happiness. The veterinary healthcare team should be the ultimate source for top-notch pet nutrition info. When clients see how the right diet helps their pets stay healthy and happy, they visit us more often. Remember, good nutrition is essential. It's smart business and great medicine. Enroll in the NAVC Pet Nutrition Coach certification today on VetFolio.com.
In this episode, I'm joined by Dr. Haley Leeper, and we're going to talk about something that is so important. And Dr. Leeper, something I think you probably have a really unique perspective on this palliative care. So first of all, thank you so much for joining me.
Oh, thank you for having me. I'm really excited to talk about palliative care and how that relates to veterinary oncology.
Absolutely. Absolutely. So let's start really basic here. What is palliative care?
Yeah, it's a really great question. This was a phrase that was first used in like the 1970s by a surgical oncologist to avoid that negative connotation that usually comes with hospice. And so what this really is focusing on alleviating the symptoms related to cancer diagnosis and not necessarily focusing on cancer care itself.
It was the term palliative care. Does that specifically refer to cancer, or is it any kind of long-term chronic disease?
I think it could specifically be used for anything, or should say not specifically used for anything. And because you're really focusing on the symptoms and not treating the underlying cause of that. So even chronic kidney disease or diabetes, anything that comes secondarily to that, you probably could relate it to it. But specifically for cancer care, we're usually talking about focusing on things like pain management, nutritional management, GI support, so anti-nauseas, anti-diarrheals, that sort of thing, stuff that can come or arise secondary to the cancer diagnosis itself, and not necessarily attacking or treating the cancer formation in the pet or patient.
When I think of co-managing a case with a specialist, which is oftentimes the case with when it comes to cancer, a lot of those treatments really need to be done by a specialist, managed by a specialist. So we end up co-managing these cases. How would the approach to palliative care change when we're co-managing a case, obviously in a cancer patient in this example?
I think it's important to work as a team when we are looking at palliative care, especially with going back and forth as specialists. It's really important to rely on our primary care veterinarians to know a little bit more about these patients' history. You likely have known these pets from puppyhood or kittenhood, and you know the clients and what they prefer, and maybe what they've chose throughout that pet's life as far as different treatment options or different decisions along the way. And so I think it's really important to kind of heavily rely on one another and work on it as a team. And I think a really important resource to bring up at this point is the Collaborative Care Coalition. And I think that they have done a really great job to try and highlight that importance of being a team. And what they've done is they've looked at several different surveys with various different chronic diseases, so renal disease, heart disease, and cancer. And they survey the clients of pets with these kind of more chronic diseases. And they ask what were their top predictors of satisfaction for the various team members. And specifically looking at veterinary oncology, they published their study just last year in the JAVMA journal, the Journal of the American AVMA. And when they surveyed the pet owners with dogs with cancer, they found that the top predictors of satisfaction with primary care veterinarians was staying involved in the case. So not just referring and kind of having their hands off, their willingness to work with other vets and specialists, as well as their responsiveness to, their needs or questions that arose. And the top predictors that they found for satisfaction with specialists was providing accurate cost estimates, our knowledge in the cancer diagnosis and treatment options, as well as effectiveness of treatments. And so I think we can really learn a lot from that survey on both sides of the fence of what we can do to really support clients during this time and really approach this as kind of, we've mentioned, kind of a team effort, so that we can get the best outcome for the client during this time.
I think that is a really powerful message about working together as a team, because there can be kind of some gray area, a little bit of ambiguity and confusion about, okay, well, I referred this patient and I don't want to step on your toes. And I would imagine you guys are probably feeling the same way, like, where's that middle ground? And so it just seems to drive home the importance of communication.
Yeah, absolutely. I think you're touching on a really big point that we always like to try and discuss with, our students here, as well as the referring population, is we're really going to heavily rely on one another. A lot of times we're asking primary care veterinarians to do the monitoring blood work in between visits so that clients don't have to travel all the way here just to get a CBC performed. Also, continuing with routine care, right? We know that dogs and cats still can have other comorbidities or can still ingest things that they're not supposed to or need dental care or vaccines and this and that. And by no means do we want to step on anyone's toes or take over, because we are not experts in that. And also kind of managing those comorbidities that can arise in an older pet population. And so it's really important to have those lines of communication back and forth and be able to rely on one another throughout that pet's cancer treatment.
Yeah, I mean, and that makes me feel valuable as a primary care veterinarian to say, okay, yes, this pet has a disease that I don't have the knowledge or the resources to manage, but there's a lot I can still do to take care of my patient.
Absolutely. And the same for us on our side is, we've gone to advanced training and have been really in the thick of things of learning the ins and outs of cancer treatment, diagnosis, prognostic factors. But throughout that time, we have not stayed up to date on, vaccine requirements or what's the best dewormer or how do you treat an ear infection. We're usually out of date with that. And so we're really trying to communicate that with our clients when they come in with those types of issues to be like, you're going to be best served to go back to your primary care veterinarian who may have likely has treated this in the past and knows a little bit more about that, and let us focus on maybe the cancer diagnosis.
Absolutely. Just really strengthening that relationship and how
Correct.
it's going to take both of us.
Yep, absolutely. It takes a village.
Yes, yes, agreed, agreed. So let's throw a buzzword out here that we talk about a lot in vet med these days, and that's spectrum of care. And I feel like this is extra important when we're talking about palliative care because we do, we're so fortunate. I joke around a lot and what a time to be a veterinarian. And it's really not a joke. We do have a lot of options, a lot of resources, a lot of new drugs coming available. But sometimes we run into a situation where it's like, just because we can, does that mean we should? And I think that's where we start to get into spectrum of care. So I would love to hear kind of your perspective from oncology on spectrum of care.
Yeah, I think you hit it right on the head with it's a buzzword right now in veterinary medicine in general, but especially in veterinary education. And they're really striving to have us teach or offer to our clients not only one option for diagnostics or treatment, but to really provide a spectrum of options. And that can range from basic low cost, maybe low tech options to more advanced higher cost state of the art treatments. So really providing a full different, a variety of different options for clients to pick so that they can choose the best one for their family. And I always joke with other veterinary professionals and students that it was really easy to adopt this in oncology because we've been doing it forever. And I think that's partly because oncology, we try to treat these diagnoses like a chronic disease. Oftentimes, we may not be able to get a cure, but we're really aiming for good quality of life. And so sometimes that means there's not a right answer for how to diagnose or which treatment options is really going to be the best. And that allows us to really provide a variety of different options for owners. Maybe like a curative intent is on the high end. We're going to really maybe do a large surgical dose followed by chemotherapy, or a middle of the road. Maybe we're just going to offer something in between, or a palliative option. Again, kind of going back to just alleviating the symptoms that arise from that, focusing maybe on nutrition and supplemental meds that the client wants to add in. And so it really allows us to kind of tailor each consultation and each cancer treatment to that pet and to that pet's owners based off of that. But I think it's a really great thing to have in veterinary medicine in general. But I do think that as oncologists, we've been kind of doing that forever. So it's pretty easy for us to adapt to that.
But I'm so glad to hear veterinary students are getting that message kind of across the board because yeah, I remember getting out of vet school and the types of cases and the types of options that you have when you get out into private practice can look very different from what you see when you're in vet school. And it sounds like at least, well, I don't know if it sounds like, but my feeling on knowing that students are getting that message across the board maybe sets them up for a little bit more job satisfaction when they get out because it's not this like shell shock of what do you mean I don't have all the bells and whistles to diagnose
Yeah.
and they won't go for referral and I have to kind of piecemeal this together that they're kind of already prepared to have those conversations.
Yeah, exactly. It's not, as we know, veterinary medicine is very gray area, right? There's a reason why we call it practicing. We haven't mastered this, that there's not one cookie cutter way to go about each case, that we really need to approach this as an individual during that time and tailor our discussions based off of what's going to be best for that client and for that pet. And so I think it is a really important thing. And I'm glad that other areas within veterinary medicine are starting to look at this because it was pretty easy for us to do so in veterinary oncology.
And I think one something I've heard you say that was kind of an eye opener for me is what you said about treating cancer like a chronic disease. Because a lot of times I know I'll have the conversation with owners, they'll hear chemo and they're like, absolutely not. And I'm like, hold on. These dogs tend to do a lot better than you would think, we as humans would handle this. And I think you put it in terms of like, we're generally not going for a cure in our animal patients. It's more quality of life and maintaining for as long as possible, obviously depending on the disease process and the type of case. And that really it made a lot of sense to me to say why animals tend to do well with these chemo and radiation type of treatments, because it's more aimed at comfort and quality of life rather than, let's just wallop the heck out of them and try to cure it, because we can't explain it to them like, you're going to feel
Oh.
terrible because we're trying to fix this.
Yeah, yeah, and it's very true. It's something that we as a profession, veterinary oncologist, really need to be better spokespeople about because cancer comes with a lot of emotional diagnoses, right? It comes with sometimes a very personal experience with that. And so to hear things like your pet has cancer or we're going to talk about chemotherapy, they may relate that to an aunt that has gone through that or that themselves, right? And that can sometimes be, oh, that was not the best experience, but human oncologists can sit down with their patient and go through those options and say, we have this option A, which chemotherapy, and we give high doses, and you may feel pretty crummy, but we have this higher cure rate or remission rate. We can't do that with our dog or cat patients. And so it really comes down to us really focusing on quality of life, which is important, which means we don't use the same doses that they do in people. We don't use the same protocols, or it's heavily redacted as far as like the dosing or the intensity of it. And if we see any side effects, we really pull back. And because of that, it does mean that we don't have the same remission rates or cure rates, but that's okay for us, right? And so I think it's a real big paradigm shift in a lot of individuals to go through that. We see that constantly with students that come through the oncology rotation of saying, I didn't realize that this is the goal of veterinary oncology. And I thought I was going to see all these pets that didn't feel well. And if we see that, we're not doing our job to the best extent. And we really need to modify what we're doing. And so kind of being that voice for this is very different than on the human side of things. However, there is still the capability of having comparative medicine and translational medicine that goes across the board. But in the same extent, we don't want to see those negative side effects.
And I love how you put that. You explained it so well. And when I heard you say it the first time I went, oh, that makes so much sense. And I think it really gives us some good talking points with owners to say, hey, the goals are different. It's going to look much different than what you may have experienced either yourself or, with a family member, a close friend, or something like that. I would imagine that even though there's a focus on minimizing side effects, we probably do get some degree of side effects with these medications. And then certainly, there's veterinary visits and monitoring and things like that. And that can lead to kind of another buzzword that we're talking about here lately, caregiver burden. And just like spectrum of care, I'm so glad we're talking about caregiver burden because it's important and it needs to factor in. So can you talk a little bit about caregiver burden and especially with respect to oncology?
Yeah, again, this is another, like you said, buzzword in veterinary medicine, and it's not unique to oncology. We do know that caregiver burden is present in about half of all veterinary clients. And what this is, caregiver burden, for those that may not be familiar with it, is a response of distress encountered with providing care for an individual. So this could be caring for your mother or a family member, or this could be caring for a pet. And what it includes is both your physical and emotional demands. So if any of our listeners, or if you've ever had older or geriatric pet, you may be able to relate to this, but essentially think about all the daily needs that are related to caring for that individual. So you have meal prep. You need to make sure that they did eat their breakfast or their lunch or dinner, right? So there's all these interactions with just food prep. Not only that, there's medications. So think about how many times you have to medicate a pet, or what formulation is that? Is it a challenge to actually get that dog or that cat to take the pill or the liquid? Does that at all, change that human animal bond? Does that become a stressful event around it? Think about also, do you have to remember refills? Do you have to go and get them from different locations? Do you have to call and make sure that it gets mailed to you in time so that you don't miss a dose? There's also personal care. If you have a pet that maybe doesn't have the proper mobility to get around, and you're having to clean them up from accidents in the house, or have anything related to incontinence, either urinary or fecal, and then appointments in general, right? Those can be time consuming. Driving to and from a veterinary clinic, sometimes those can be stressful events. And so you can imagine that this all adds up and becomes a burden to the caregiver. And we need to be aware of that as professionals, and realize how we could potentially, intervene or minimize that as much as possible.
And at least have these conversations to almost like give people an out, let them off the hook a little bit, to say,
Yes.
hey, like, this is a lot that we're asking you to do. Are you okay? And are you okay with taking this on? Because we recognize this is
Yeah.
this is gonna be a hefty load we're asking you to carry.
Yeah, correct. And I think that's the first thing we can do, is we can avoid minimizing those feelings, right? And really address it for what it is, that we realize that can be a lot. And maybe this isn't, you were up for this 3 months, 6 months ago, but let's reevaluate it with how your life is now. Is this something that you're still interested? Is there ways that potentially we could reduce the number of medications, or change, formulations, that sort of a thing, to make this a little bit easier for you, and really treat every client as an individual and every visit as an individual. Just because you've had that discussion before doesn't mean that that same scenario still exists today.
Absolutely. Absolutely. I want to circle back around a little bit to your experience with vet students rotating through, saying, "Oh, I thought I was going to see, a lot of animals that didn't feel good, and, kind of these extreme cases and stuff like that, and have had a much better experience than that." Um, I think I don't know that that perception is limited to vet students. I think there are, I'm looking in the mirror a little bit here, like this concern of, like, if we do go through chemotherapy, are we gonna, what's gonna happen with these animals? And I think it can probably create some bias, not understanding that real focus on quality of life from both sides. And so I'm wondering if we can, kind of get into a little bit tougher conversation here about giving each other the benefit of the doubt as colleagues. I know, I think it's kind of common to say on the GP side of, like, our specialist colleagues, might judge us for doing that, or something like that. But in reality, it sounds like that can go both ways sometimes.
Yeah, absolutely. I think you're not uncommon out there. Veterinary oncology is a relatively newer subspecialty in ACVIM, and our profession has seen some really big advancements in different treatment options. We now have radiation therapy and stereotactic radiation. We're offering larger surgical procedures like maxillectomies or thoracotomies that maybe wouldn't have been as available, limb sparing surgeries, right, in dogs with bone cancer, that wouldn't have been available many years ago. And because of that, there may be some hesitation with, is this really the right option for these pets that have a life-limiting diagnosis of cancer? Because we are not likely to cure the pets. But what we need to do as a profession, with our vet students that travel through, or having conversations with primary care veterinarians, is let them know our primary goal with the consultation is to discuss that spectrum of care, all of those options with the client and really go through the pros and cons of each, because there will be some morbidity associated with some of these treatments, but what we hope is that they are limited and that they are transient, and that they aren't going to impact the quality of the life long term. And I always use a classic example of, a primary bone tumor on a dog causing significant pain and distress potentially to this pet. And an amputation seems like a very large surgical dose. However, we find that many dogs do really well with amputation. And if you think about it, the recovery for that is the same as like a spay. It's a skin incision. So within 2 weeks, they're up and running, and usually before then, and we have to kind of keep them quiet, but they're up and running and acting like their old selves and have a lot of energy, and that pain is reduced. And so sometimes we go through a little bit of morbidity to get a longer, better quality of life over time. And we're having those discussions with the clients. And so I think, as we're expanding in our profession, we need to do a really good job to explain that to all the stakeholders, that we realize that you may not choose to do that for your own pet. However, this is a reasonable option for this client. Maybe they want a little bit more time to say goodbye, or have their kids come back from college to say goodbye to their family pet at the time of the holidays. We hear that a lot. And that's a reasonable ask, right? As long as we can continue to have that pet have a good quality of life. If we're not achieving that, we're going to have those difficult conversations about quality of life and end of life care. But I think it's a really good point, that I think a lot of primary care veterinarians probably feel like they're being judged, but I think we also as specialists can sometimes feel that. So it's really important that at the end of the day, there's not one right answer, and that we're all just trying to do the best that we can.
And it's just communication and
Yeah.
understanding, what was the conversation, what is, what's going on your side versus what I'm seeing, and with the pet and the client and everything like that, and really trusting each other that we're all looking out for the pet's best interest.
Yeah, and being aware that you may see a case, and you see it at hindsight's always 2020. You're seeing it in a different scope or a different lens. We're all doing the best judgment we can with the information we're given on that particular day, and things may change. And I think it's really important to have that kind of communication and that realization that it's not always, black and white.
Especially when it comes to any chronic disease, but
Right.
cancer in particular, there's a lot of gray area.
Correct. Yeah, I agree. 100%.
And of course, we've, talked about the number one priority here is quality of life for the pet. So when it comes to evaluating quality of life, that can be another really gray area that can be hard to evaluate. So are there objective measures for determining quality of life in pets?
Yeah, I think, there are many different scales or references and tools that you can use as or recommend as a veterinarian to your clients. And you need to find one that works well for you and for them. And what's great about a lot of the quality of life skills is that they're going to evaluate many of the things that we talked about with palliative care, as far as, does the pet appear painful? Is it eating? What is its activity level? Is it urinating and defecating normal? And they can usually put a number to it, which gives it a little bit more of an objective response versus subjective, and allows individuals, both the client and us as veterinarians, to see trends over time. And so if you're starting to see that number be lower over the course of a couple weeks, then you can reinstate or have that conversation again about quality of life, or what we can do to intervene about pain medications and that sort of a thing. And it's really important to understand, when we're talking about these quality of life scales, for clients to consider filling those out at different times of the day. I'm sure you're probably thinking, yeah, that makes sense. Think about like an osteoarthritis dog, right? May have a worse morning, but an okay afternoon. And so kind of doing it throughout the day can be super helpful, as well as asking for different family members to fill out the quality of life life, as we're all viewing our relationship with the pets a little bit different, or seeing potentially, oh, I thought the dog looked painful when you went out to go to the restroom, and maybe, your life partner, significant other did not feel that way. It can open a conversation about what each other is seeing and where those kind of endpoints may be. And so I think that those have been really helpful things I've learned from various professionals who really focus on quality of life and end of life care, like the lap of love professionals. I think that they do a really great job of talking about quality of life assessment.
And I love the focus on trends because, certainly one bad day is not indicative of anything, but neither is one good day. And
Right.
I know I've told pet owners in the past who have asked, like, well, how do I know, if it's time? And I've said, well, get one, a calendar, and if you have a good day, put a smiley face. If they have a
Mhm.
bad day, put a frowny face. See, what's your ratio here? What's going on? And this sounds like a much more scientific and objective way to do that than smiley faces and frowny faces. But it
But
still
it,
gets us those trends.
right. And it gets down to the same thing, right? At the end of the day, was that a good day or a bad day, right? And sometimes that can be helpful looking at multiple different factors. Sometimes that's overwhelming for clients. They're like, I don't want to think about I don't know if they defecated. They just go outside, right? That may be too much for them. And saying, was this a good day? Or did Fluffy do the one thing that Fluffy really enjoys doing today? Great. That's a plus day, that sort of thing. So you can really, again, tailor it to the client to make it helpful. Because if you give them homework and they're not interested in doing that, it's not going to help anyone in that situation. So I think it can be very, modifiable.
That's such good advice to say, oh, this is like the scale that I have for you. No, to say, okay, well, if this is too much, how do we break it down in a way that's really going to give you an idea what's going on?
Yeah, yeah. And it really touches on another resource that I always like to bring up when we talk about quality of life, and that's goals of care conversation. And this is such a great resource. I really highly encourage everyone to kind of Google this. And what it does is it gives you kind of a set guideline to have a conversation about a client's values and goals related to that pet's diagnosis. And again, this isn't specific to oncology. It could be any chronic life limiting disease as well. And it really kind of allows you to touch on 8 different sections with that client and get an understanding of where they're at. And those 8 different areas is first and foremost, what is their understanding of the diagnosis? What are they coming in with? What have they Googled? Where are they having specific questions about? Because you may have a different conversation with a client who has a history with maybe diabetes than someone who's never had that in a pet or in their personal life and have never heard of insulin or anything like that. The second thing is their information preferences. Do they want that, very large scientific overview of this is what lymphoma is? It's a cancer of a lymphocyte, and this is what lymphocytes do in the body. Or do they really specifically only want to get to what are my treatment options and go from there? And that really helps you tailor it down, because if we give them too much information, they're not going to remember it, right? And they're not going to be able to make those decisions. The next thing is prognosis. Are they aware of the pet's prognosis? And that gets it out in the open. We can have a frank conversation about it and then make sure everybody's on the same page and talk about their goals. What is your goal? Is it, like I said, to have this pet live as long as we possibly can? Is it to make sure it gets through Christmas so the family members can see it? Is it to really only focus on it really enjoys doing an outdoor activity, and that's going to be really its life, fulfilling goal? And that's really important for all of us to be on the same page, as well as their fears and worries. What are you worried about? What would be a stopping point for you, so that we're all on the same page? And if we're seeing that happen, we can be an advocate for not only that pet, but for you during that process, as well as trade-offs. And then lastly, kind of aid in dying. What are their beliefs? Not everyone does believe in humane euthanasia, but that doesn't mean we don't have options to alleviate symptoms related to dying, and how we can help one another through that process. And And I like this because it's a nice, easy sheet that you can literally bring into the exam room with you to have that. But it's something that really important to have at various points throughout that pet's diagnosis, because that's going to change. So I will commonly have conversations with clients. I'd be like, you have told me that a stopping point before is if this pet is hospitalized for this diagnosis. You know, Fluffy's now in the ICU, being well managed. We expect to have, Fluffy out within 24 hours. But is that still a stopping point for you? Where are you guys at? Let's revisit your goals, that sort of a thing. And it allows everyone to have those conversations to make sure that we're all on the same page.
Absolutely. Yeah, that and I love the, kind of having it spelled out because it can all be very overwhelming, especially, if it is a pet you've known since puppyhood or, a very emotional owner or both. And it can be hard to kind of think through this conversation in a logical way. And that seems like just kind of a very organized way to get all the information out so we all end up on the same page.
Yeah, yeah. And we can be like, well, they've always said this, or they've always, mentioned that they wouldn't do X, Y, or Z. Well, people's preferences change, right? And I always say that too, with the common question that we get as veterinary oncologists of what would you do if this was your pet? And I always tell them, I'm really approaching this as a medical professional, as an advocate for your pet, as an advocate for you, helping you through this diagnosis. And there's a lot of factors that are involved with making a decision related to your pet's care. We talked about the time commitment, we talked about financial commitments, that sort of a thing. And so I could be in the same position tomorrow with my own pet, and I might choose something differently than you're going to choose. And that, again, that doesn't mean that there's a right or a wrong answer. That was a right answer for your pet family at that given time. And you can see that change, especially towards, chronic diseases that end, the pet's life, that sort of thing, that you're dealing with those quality of life, that those may change over time. So it's really important to kind of revisit them.
Sure, sure. That's such good advice. This whole conversation is full of such good advice. I'm so excited about it. One of the things we talked about is how many options we have in veterinary medicine, even compared to just a few years ago. And one of those options is Laverdia CA1 or Verdinexor. So I'm wondering your thoughts on how this drug could fit into a palliative care plan.
Yeah, this is great that we're seeing more and more drug companies and drugs go through the full FDA process. So Laverdia CA1 is conditionally approved at this point, but it's another tool in our toolbox, which is great. And it's an oral formulation, and you don't need to be a veterinary oncologist to prescribe it, which is great. And what we have seen in their initial studies is that this is given, typically twice a week. Oftentimes, they recommend 72 hours in between doses, but we usually say give it on Monday and Thursday. So it's really not a daily dose. So that reduces caregiver burden, right? Instead of having to give it daily or twice daily, you're saying give a pill just twice a week. We've talked about, us in the oncology world have seen some liver enzyme elevations and some thrombocytopenia, but that's really pretty easy to monitor with monthly blood work, and not uncharacteristic of most of our drugs out there that we use. So pretty easy to kind of fit into if you are a specialist or if you're a referring veterinarian, to try and give this as an option. And it kind of, the response rates were very typical of what we see with a lot of our individual drugs, of a overall response rate of around 34% and a clinical benefit in about half the patients, meaning that the disease did not progress. And that time before it progressed was anywhere between, 1 to 3 months. And so I think that this is just another tool in our toolbox that can be helpful for veterinarians to kind of know about. And I'm pleased that it's an option that we have.
And I know in the past when I've talked about Laverdia CA1, it's been from the perspective of kind of using it as a bridge between diagnosis and referral to an oncologist. Is this something where, we potentially could keep these dogs on Laverdia CA1?
Yeah. This is what's so exciting about this drug in particular as an oncologist is that we know that it's not an MDR1 substrate, meaning that it's not likely to cause that resistance that we can see sometimes with prolonged steroid use. So this is a great option for patients that are waiting to see an oncologist, but are becoming impacted by that lymphoma diagnosis and need to start treatment before they're able to start, maybe injectable chemotherapy.
Absolutely. It is really exciting. I was just blown away when I first heard about it and I went, "Wait, it does what?" And it's so exciting to have this option to buy us some time and really give these animals some benefit.
Yeah, I think it's great. Like I said, I'm always happy to see when drug companies are going through that full FDA approval process because we have very limited amounts of drugs specific for veterinary oncology. Really, this is like the third out of all of them. All the rest of them we use off-label from human use. And so this is really exciting for veterinary medicine and veterinary oncology specifically.
Very cool. Very cool. Well, Dr. Leeper, this has been such a fun conversation. I've just really enjoyed all of the information. Thank you so much. Any final thoughts you want to share?
Yeah, I really appreciate the opportunity to talk about this. I think that, cancer care can come with, like I said, a lot of emotions. It can come with some preconceived notions, and it's really important for us to talk about how we can better communicate with not only our team, our primary care veterinarians and our specialists, but our clients about the different options that we have and how we can better support one another throughout this diagnosis. And so thank you for allowing me the opportunity to kind of expand on this and talk about it a little bit.
Of course, of course. Thank you so much for joining me and for giving us all of this information. I want to say a huge thank you to Dr. Leeper for joining me for this conversation. She had such wonderful insight. I really enjoyed every minute. I also want to say a big thank you to Decra for making this episode possible. Of course, thank you to all of you out there who tuned in for this episode. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast. I'm told that it'll help other veterinary professionals like you find this and other great episodes we try to put out there. For more episodes like this, click on the Education tab of the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassie DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day. Important safety information. For use in dogs only, Laverdia CA1 Verdinexor tablets is conditionally approved for the treatment of lymphoma in dogs. Not for use in humans. Keep this and all medications out of the reach of children. Children should not come into contact with Laverdia CA1. Pregnant women, women who may become pregnant, nursing women, and children should not handle or administer Laverdia CA1 or come into contact with the feces, urine, saliva, or vomit of treated dogs for 3 days following treatment. Laverdia CA1 can affect male fertility based on animal studies and studies in humans. Wear protective, disposable, chemotherapy-resistant gloves when handling Laverdia CA1 to avoid direct exposure to moistened, broken, or crushed tablets or biological waste from the treated dog, feces, urine, saliva, or vomit. Do not use in dogs that are pregnant, lactating, or intended for breeding. Laverdia CA1 is a possible teratogen and can affect female and male fertility. Dogs should be frequently monitored for hematologic and serum chemistry abnormalities. The most commonly reported adverse reactions in dogs include anorexia, weight loss, vomiting, diarrhea, lethargy, polyuria, polydipsia, elevated liver enzymes, and thrombocytopenia. Please see package insert or visit decra-us.com for full prescribing information.